There's four different formulations for iron. There's the heme iron, the non-heme iron, the ferric salts, and the IV formulations, which are usually iron with the sugar. Heme iron is typically an animal-based product. It's usually bound to myoglobin or hemoglobin with the iron attached to it, and you take it. It has very good bioavailability. You'll absorb a lot of it. The second product is called non-heme iron. It usually comes from a plant-based source, such as lentils or soybeans. It has less bioavailability, more GI side effects, and they say that vitamin C actually helps with this type of iron. So if you take iron from a vegan source, third formulation most commonly prescribed is called ferric sulfate or ferrous plus a salt. It's attached to a salt, the iron molecule. Ferric sulfate is the one that's been most heavily studied, so we know how it absorbs, we know the side effects, it's easily prescribable, and it's very, very cheap over the counter and or prescription. Formulation is an IV formulation. It's usually the iron molecule attached to a sugar. So think of like IV iron dextran, IV iron sucrose. Severely anemic, I would recommend IV iron to replace the iron stores faster and more effectively. Anything you take in the GI tract will absorb, and there'll be some degree of GI loss, so it's not 100% bioavailable, whereas IV goes straight into your blood and your body absorbs it and utilizes it. Which IV formulation you get approved for will depend on your insurance company and what's on formulary at the infusion site and or hospital you're getting your infusion at. No drug is one better than the other. Obviously, some formulations have less dosages, so you can get the IV faster. For example, Venofer has 5 doses, and that's at least every other week. So coming in for 5 times to the hospital to get an IV infusion versus IV Dextran, for example, which is 1 single dose. Both are equal efficacy. There's no real head-to-head trial comparing them, but patients respond beautifully to all those IV irons.